If you are over 60, a quiet habit you do every single night could be raising your stroke risk without you even realizing it. There is no pain or sudden warning. You go to bed feeling fine, but by morning, the way your body was positioned for hours can lead to confusion, weakness, or trouble speaking. While many think strokes only come from diet or smoking, doctors are seeing that nighttime routines and sleeping positions play a massive role as the brain becomes more sensitive with age. The first major risk is sleeping completely flat on your back. For seniors, having the head at the same level as the heart makes blood drainage from the brain less efficient. Since older blood vessels are stiffer, blood can linger longer than it should, increasing pressure inside the head and the likelihood of clot formation. To fix this, you should slightly elevate your head to let gravity assist your circulation. Another dangerous habit is sleeping face down, or the prone position. This forces your neck to turn sharply to one side for hours, which can narrow the key arteries that carry blood to the brain. In older adults, even mild compression of these vessels for a long time reduces oxygen flow. Instead, you should try side sleeping with your neck in a neutral position to keep the blood moving freely. Many people also sleep with blankets pulled over their heads for warmth, but this causes oxygen levels to drop and carbon dioxide to build up. For a senior's brain, lower oxygen can thicken the blood and make circulation harder. If you need to block out light, use a sleep mask instead of covering your face. Similarly, sleeping upright in a recliner every night is risky because it causes blood to pool in your legs, which can lead to clots that eventually travel toward the brain. If you must sleep at an incline, a firm wedge pillow on a bed is much safer than a chair. Other risks include sleeping with an arm tucked under your head, which compresses vessels in the shoulder and neck, and going to bed immediately after a heavy meal or alcohol. Digestion draws blood away from the brain, and alcohol makes blood pressure unstable during the early morning hours when stroke risk is highest. You should wait at least 2 to 3 hours after eating before lying down. The safest way for seniors to sleep is on the side with a pillow between the knees to keep the spine and hips aligned. This position supports the airway and allows for the best circulation. If you prefer your back, ensure your head is gently elevated and place a small pillow under your knees to support your lower back. These small changes at Senior Health Tips are not about fear, but about making sure your brain stays protected while you rest.